tip number one would be do a clear mental health audit of what you are already doing in the organization, what your spend is on, what your issues are, what your absence rates are, and who are seeing what health providers. This is the bit most organizations don't seem to do. I see a lot of strategies that are written that are not based on anything. So a really clear audit of maybe a year or two's baseline data, looking at the cost of the business, the cost of health providers, what you have in place before you even start, so that your strategy is based on what you have already, how that can be improved, what you need to keep, and how you build. The second thing I would suggest is that you get the right health providers in, which may mean spending more money. But all large organizations of any size tend to have occupational health, employee assistance programs, and private health insurance. But not many have the clinical skill or the HR skill to challenge what those health providers are providing, how they provide them, how triages are done, and actually what is being provided. So a good health and mental health strategy has to have the literacy and the education. But actually, in order to support people who are presenting with problems, you need to make sure you've got the right support, you know what you have, it is correct for you, it's suitable for your employees, and it's set up properly, and your HR and managerial processes are built around it. My third tip to employers looking for an actionable solution is to spend a lot of time drafting a full stakeholder map of who's going to be impacted by a health or mental health program. So health and mental health, to actually have something that creates sustainable change for employees, requires culture change. And you need buy-in from all different parts of the organization, from the board, from senior leaders, from senior management, from middle management, from line management, from graduates, from HR, from employee relations, from benefits, from learning and development, sometimes from IT, sometimes from facilities. So the whole organization needs to be on board and bought in to put in a comprehensive solution. The trouble is that very often doesn't happen, and mental health is becoming a little bit of a football that's political between diversity and inclusion or HR, and very often while senior leaders talk about mental health, they then leave it to HR to implement, and they may not have the right skills. So before any plan is put into place, develop a clear stakeholder map. Spend time getting all different parts of the organization on board and bought in, and then that's the only way really you're going to create a solution that changes culture and has an impact on all of your employees.